fluid could be ballotted between this hernia and the joint capsule. And this can be seen as an incidental finding in some horses or in association with osteoarthritis of the affected joint. In the horse on the left, we can see that there is distension of the antebrachiocarpal joint capsule, both dorsally, highlighted by the single arrows, and in the palmar aspect of the joint, highlighted by the double-headed arrows. This was associated with severe osteoarthritis of the antebrachiocarpal joint. In the grey horse on the right, we can see distension of the middle carpal joint capsule, highlighted by the small yellow arrows, and also a synovial hernia of the antebrachiocarpal joint, highlighted by the thick yellow arrow. This was also associated with very severe osteoarthritis of both the antebrachiocarpal and middle carpal joints, with full thickness cartilage defects and very considerable periarticular modelling. Don't ignore subtle swellings and look carefully at the metacarpal regions from all angles. All these three horses have subtle swellings on the palmar or palmarolateral aspects of the metacarpal region, all of which were associated with significant injuries of the superficial digital flexor tendon. On the far right, the swelling was very much towards the lateral aspect of the tendon, associated with a rather unusual lesion confined to the lateral aspect of the superficial digital flexor tendon. It is important also to recognise that the absence of lameness does not preclude significant injury of the superficial digital flexor tendon. If there is visible or palpable enlargement, ultrasonographic evaluation should be performed to rule in or to rule out the presence of significant injury. It's also important to appreciate that proximal injuries of the superficial digital flexor tendon may not be associated with palpable enlargement, although the tendon may actually be enlarged. And this is because the tendon in the proximal metacarpal region is effectively compressed by the thick, dense carpal retinaculum, highlighted by the yellow arrows in both the ultrasonographic image and in the anatomical specimen. The horse depicted in the top right ultrasonographic image has significant enlargement of the superficial digital flexor tendon. The cross-sectional area was 1.43 square centimetres compared with 1.24 centimetres squared in the contralateral limb. However, there was no palpable difference between the two limbs. These proximal lesions are generally associated with episodic, moderate to severe lameness. If you see an obvious swelling associated with the second or third metacarpal bones, or less commonly the fourth metacarpal bone, palpate carefully to determine whether or not there is any heat, pain on palpation, and whether the exostosis is separable from the suspensory ligament. Bear in mind that not all osseous abnormalities detected radiographically are necessarily of current clinical significance. They may reflect old injury. It may only be possible to determine accurately whether or not there is adhesion formation between the exostosis and the suspensory ligament by ultrasonographic evaluation, performed both with the limb in a weight-bearing and in a non-weight-bearing position. These arrows in the two limb specimens point to significant enlargement in the region of the accessory ligament of the deep digital flexor tendon.